If you're interested in receiving credit, please leave your Zoom window open once the presentation has ended. A link to complete the eval will be available at the conclusion of the webinar. And once you've finished the evaluation, please give about 2 weeks to receive an emailed version of your certificate of completion. And you have to be on for the duration of the webinar in order to receive the certificate. So today's topic is individual and family recovery, a parallel process. One of our speakers, Dr. Phoenix Adams, had a patient emergency today and is not able to attend. However, we're still pleased to introduce Michael Perlman to cover this topic. Michael has been a family therapist here at Caron Renaissance in Boca since 2018. He was a member of the first group of Caron therapists to be trained in dialectical behavioral therapy, DBT, an evidence-based treatment that has been proven to effectively treat patients. Since then, he's been instrumental in implementing the DBT program specifically at Caron Renaissance. Michael started working at Caron Renaissance as a counselor assistant back in 2014 and was promoted to a primary therapist in 2015. He actually came to Renaissance as an intern in 2013 while receiving his master's degree. So he's been with our family here at Caron for quite a while. And with that varied experience at Caron, he's seen how patient care and quality drive Caron's approach at all levels of the organization. And that attention to care and the emphasis on treating the precipitating issue and ensuring that the whole family receives treatment have given Michael a deep respect for Caron and his colleagues. Michael's education and professional experience prepared him to successfully work with our dual diagnosis patients and families. He began his career working with children on the autism spectrum and their families, serving as both an educator and a support for the entire family. We're so grateful for your time, Michael, today. Thank you for being here. Everyone, please welcome Michael Perlman, and I will turn it over to you, Michael.
Amanda, thank you. I apologize. Phoenix is not here today, so part of the presentation today is actually going to be discussing, the models of treatment with families, and at Caron as well. We jump in, we support, and we help balance some of that equilibrium to help support patients, staff in the recovery journey. So I apologize. I know it's hard because I can't see all your faces, and humor is tough because of the silence, but I know that everybody wanted to see Phoenix, so I apologize for that. You're gonna have me, so hopefully you're all in for a treat. So I'm just gonna pull up the presentation. 1 second. Amanda, you can hear me? Everything sounds good? Okay. All right. So thank you, everybody. So individuals and family recovery, a parallel process. So a psychodynamic model of treatment for addiction. Right? So the mental health and the characterological makeup of patients related generationally, family themes are believed to predate the onset of addiction. What we're really looking for in understanding the family is really, were there any behaviors that molded or created who we are as people that interfere with the addiction process, really understanding generational themes and how they contribute to relapse potential, not only in the present, but also in the future. So really the inability to manage one's emotional life, profound dependency needs, generational themes, distortions that the world will accommodate and fail attempt at self-care will create states of anxiety or characterological depression. Meaning that what we're looking for is it a situational environmental change within the family, or as well as is this characterological and mental health a culmination of both, and how this is interfering and directing a relationship in recovery. So looking at that parallel process and really integrating, the core concepts of, is this in fact affecting recovery? So the defensive structures of this addiction is fueled by several different layers, different attempts of defense mechanisms, not wanting to conform to social norms, thinking that a patient or a loved one knows better, really wanting to develop deficiencies is part of this relapse process that is interfering with the recovery process, not only with individuals, but with the families. So what we really want to understand from a core component, that the addiction is an autonomous process. And while the family did not cause it, they can't cure it, but they do influence the process of recovery as well as relapse, right? So if there is an active user in the house, mom, dad, significant other, and they're unwilling to make some corrective experiences or corrective change, those are obvious interferers. If we are dealing with a loved one in recovery and the parent, again, significant other, is using their loved one in early sobriety as their therapist, to dump their emotions. Again, these are treatment interfering, recovery interfering behaviors that we're looking for in our recovery process that are interfering. So the family is not necessarily, again, using the term sick is intentional because we want to help create new vocabulary and new definitions to language that we traditionally use that have high intensity that are correlated to it that in fact may not fit, right? So some of the traditional DSM criteria of the past, the vocabulary has changed significantly to help families and diagnosing a little bit easier so that it's not those taboo words, right? So it's not that anybody's sick, right? So what the family is doing is they're doing the best they can with the information they have, which we'll refer to as natural parenting. They're protecting, they're defending. So the best way of explaining this to a family and really having them participate in this treatment process, as I'll go over this several different ways as far as the roles that family plays in this recovery journey, is that the family is really operating from a child being an adolescent. What they're doing is the nurturing. The child cries, you give a bottle, you give a blanket. What happens is that their child developmentally is not maturing to the capacity of adult undertaking or interdependent role taking. So the family traditionally will intervene. And of course, with an infant or a newborn, if anybody has one, knows that you're not sleeping and you're hyper focused on everything else except yourself. And what happens with families when there's an active addiction, their focus is switched gears. And so where we see family systems and the dynamics play out is that they are absorbed and consumed by the addiction, right? And so what we find out as we explore further in the family dynamic is are these generational themes? Are these stressors that have impacted not only the primary family we're working with, but history as well, right? So has the mother's mother always been the caretaker? Have they been the enabler? Are they still enabling the parent in the system? For example, giving money, paying rent. Is that a generational pattern? Is that a theme? Has there been significant grief and loss that is having the family hold on so tight out of fear of losing another family member that they're not allowing maturity or growth for the loved one that's in active recovery? So these are key target areas of the concepts that we're addressing as far as understanding the family dynamic and ongoing understanding of family recovery as part of this process. So some of the conversations that I've addressed is really how the family work has changed over time. So what we want to do is have the family participate, be part of this collaboration process, not the old traditional way that was effective for a period of time. But now we're understanding a huge mental health component of the recovery process and addiction and how the co-occurring disorders are impacting one and the other. So it's not the old traditional way where let the experts be the experts and tell you everything. Is sometimes families are not able to detach fully. So our process as far as meeting the family where they're at and understanding how to do some harm reduction, how to do some other treatment modalities, not the traditional, well, let the experts fix my loved one, right? We really want to rear away from that language of fixing and curing and putting the full responsibility on someone else, right? The externalizing blame. So we're shifting from the traditional let the experts fix my loved one to collaboration, right? Again, family is in recovery. This is a family disease, meaning that it is impacting everybody. Not that everybody's in active addiction, but again, that there has been a change in the family system. Also, again, a conversation that I'm sure a lot of people hear, which is it's the friends, it's the lawyer's fault, it's the cop's fault that they arrested my son for speeding, right? Not a lot of the externalizing blame, right? So what we're finding out again is that sharing experiences. One of the biggest conversations that I have ongoing when I'm working with families is that their loved ones traditionally forget that their parents were people. I know that sounds silly, but they forget that they've had a life before, right? They've been put on a pedestal, a hierarchy, authoritative figure, and parents have life experience. They have situational experiences. They are reacting and responding to what they've learned. They're reacting to things that they wanted to never do that their family told them and scared them straight, right? Those philosophies are effective for some and ineffective for others. So really understanding, what coping skills and what effective strategies will help. Again, understanding versus labeling, right? So there was a time where saying you were an alcoholic was unsafe and you had to do it in private, and therapy was not socially accepted. Really, again, it's normalizing some of this language, helping the family understand that they're not alone in this process, that there is other families, there's other resources, other ways of collaborating in your own recovery journey. Right? Again, redefining some of the language. Recovery doesn't mean the traditional, if you have a glass of wine once a month because your doctor recommends it, it doesn't mean you stop doing that. It just means that someone else in your life may not be able to do that, not clear the house of all alcohol. And when your loved one comes home, to no longer allow them to have any cravings or triggers. It's really about understanding and having a conversation that there may be alcohol at this party. And that doesn't mean that you can't come, and sharing your worries and concerns, right? That process as far as the family model has shifted. So again, really understanding the cultural norms, the values, the family narratives, right? It's not going to be a huge shift where we're going to change everything in the family. The goal is to make some pivots. The way that I explain it in Family Workshop, this is not on the slide, so hopefully I don't go too far off, is really we're doing some chiropractic adjustments, right? We're changing some of the mindset. We're doing a quick shift. You hear a crack and a pop at a chiropractor and you instantly believe that there's relief without even standing up yet, right? So that's something that we work on with the families, right? So that instant relief they get when their loved one is safe in treatment is in fact a good start, but that doesn't mean that the recovery, the physical, emotional, spiritual change doesn't continue. So ongoing collaboration, helping them get into recovery themselves, helping them align with appropriate boundaries. The other thing that I see and I experience a lot is families set unrealistic boundaries that they're unwilling to hold. So what that does is it creates a distrust, not only with significant others and families, but with their loved one in treatment, because they don't believe. They perceive that they're bluffing, or they can cut a corner, or why listen to authority and rules if my parents can't even hold the line, right? So that again is another component that we're looking at when we're treating the family is, what have been the cultural and social norms as far as boundaries? Has it been an open door policy? Is there a curfew in the house? Do you allow your family members to go into your wallet? Do you allow them to have access to your bank accounts? Do they have every single password to every single account? You'd be surprised that some of the families give full-blown access to everything. Again, earning before receiving and being trustworthy. So some of the treatment of the family system is really being part of the family, right? Not thinking or creating a way that you know better than the family, but really facilitating change within the family, right? So what we do, or what I traditionally do, is I immerse myself in the family. I thank them for inviting me into their family system, whether, I use a little humor, whether they like it or not, I'm now part of your family. Really, again, disarming them, allowing them to build trust and build rapport, creating an expectation that I'm in it with them, that if it's 2 o'clock in the morning, 5 o'clock in the afternoon, that part of that family system participation, as much as I'm modeling it, we want them to do so as well. And again, it's about creating a unique roadmap and blueprint for each family member. Again, using that term recovery again, fits differently for each person. So as far as looking at the family system, I'm being a little repetitive, but their recovery process may be participating in yoga. It may be practicing mindfulness. It may be the traditional therapist, encouraging family support groups. Again, it's rebalancing the equilibrium within the family system, doing some more chiropractic adjustments. So just some theories and positions and stances that we work off of, that family therapists traditionally do, is not only with their loved ones, but also when we're doing some of that family work, we want to, listen more and talk less, right? Giving a format and a foundation where the family has been withholding, they have been in fear, they haven't had the ability to communicate safely because they are managing this on their own. They perceive they have to manage it on their own, which in fact isn't true. So starting off some of that rapport with the family is giving them a platform to communicate, maintaining a healthy level of curiosity within the family, right? The old school slogan is trust but verify, right? Really understanding, are there allies? Is there codependency? Is there a betrayal of trust? Is there an externalizing of blame pointed at someone else to distract from other precipitating issues in the family, right? The identified scapegoat, the alcoholic, drug addict, mental health patient, usually is the one that's under the spotlight, right? What happens to the family when the spotlight isn't on the identified scapegoat, the identified patient, the identified problem? What happens to the family system? So that is another component as far as how we break some of that, dependency on a crisis, right? People thrive in crisis because they've practiced them for so long. That's the distorted belief. In fact, you may be an expert in it, and that's because you've mastered it. But when it comes to your own family, including myself, I'm a softie for my daughters. If they have cake for breakfast, so be it. That's some of my own family of origin stuff. My mom did that for me, so I did that for them. Right or wrong, I don't know. That's my kryptonite, is my daughter. So again, understanding that and being able to align with families of setting expectations and boundaries that they can hold, because we want them to be able to follow through with them. When no one is looking, can that be challenged? So that's why the codependency is so important, because when they're talking to clinicians, again, the family model is when they're looking at it, can they do it when no one's looking? Or are they placating their loved one, their significant other, for their drug of choice, which is their loved one, right? That's my language that I'm using, right? Do they fall short when no one's looking? Is there a true secondary gain that's being implemented by presenting one way in front of others and then getting your needs met when no one's looking, right? That's the divide and split in the system that the family falls short from. So some of the things to break this codependency, and breaking some of those dilemmas that the family has with the split, is really putting responsibility where the responsibility lies, right? So the sobriety of the patient is for the patient. And I know that's sometimes really hard for families to hear, because they're used to default homeostasis, which is fix a problem. Be very logical. Cognitive behavioral therapy would say, let your loved one have emotions, let them think their thoughts through, let them understand their feelings, let them change their behaviors. If the family jumps in too quickly, that's not occurring. So some of the recovery process is to break that dependency, strengthen not only the patient's recovery, but also influence and support the family's recovery in the future. So the part of the core concepts of this is the family also has to identify that some of these things are challenging and are going to be difficult for themselves as well, and that their family patterns and history generationally are impacting and setting the stage for some of the relapse process as well. So nobody wants to hear that they can be part of the relapse process. Everybody wants to hear that they can be part of the recovery process and how can they fix it. This is the part where a lot of families have a reaction because they lack some psycho ed, right? So it's not that you will say something and your loved one will end up going to the bar tonight, but if you continue to reinforce, I'm here for you, here if you need $100 or there's a crisis, or if you call me, I'm available at any time. What you're really inviting them to do is to break rules and give them permission to get away with things, whether that's the intention or not. There's a lot lost in communication in early sobriety because there's a fear of being direct or upsetting the loved one. The concept of settling for crumbs, again, increasing expectations over time is really the core of what the family needs to do, not only for their loved one, but also for themselves. So part of this parallel process and defense mechanisms that are created and are generationally built, which is a conversation that's really hard for families to have, which is if your son or daughter got arrested, what are the implications on you, right? So is a misdemeanor that big of a deal? No, not really. Okay, well, what about a felony? Are you going to hire a lawyer? Are you going to get your son out of jail? Are you going to pay the bail? You know, what are those underlying messages really saying? Because the underlying message says, as a family name, a felony is something that we're going to jump in for, right? Again, the expectations of how does the family recover by saying, I'm not going to pay for your legals at all. What does that really mean, right? So when we see the patient lying, stealing, using substances, we're seeing the family lie to staff, even actively using substances, undermining the recovery process. When we're seeing the emotions being avoided from the patient, the family not wanting to get involved emotionally or in the recovery process, this is when we see some of those relapse signs that the families don't want to hear about. This is where some of that creation and fear come in because they want to defend what they perceive has been effective. And externalizing blame is kind of the number one offender. It's everybody else's fault except the person that actively put the bottle in their mouth, or the husband or wife that wrote a check for $10,000 and said, don't tell anybody that I just paid for your DUI. Right? So really looking at how some of those shifts are, I'm no longer going to tolerate that. I'm no longer going to allow that to be in my life. The situation that I always come to with families is if your loved one was one of your employees, would you continue to employ them over time? Most of the time, the answer is no, I wouldn't. But again, understanding that my daughters are my kryptonite and that I may say something and doing it and following through may be harder is meeting them where they're at with the expectation that they can hold. So understanding some of the family risk factors and risky behaviors. I touched upon a lot of this, but really looking at emotional regulation. Right? So referring to DBT, dialectical behavioral therapy, is we want to make sure that the family as well as the identified patient are able to regulate their emotions in a manner they can communicate effectively. If they're not communicating effectively, we see this traditionally. Hope someone laughs when I share this, right? When there's silence in a session with a parent in the room, and then a parent is asking 100 questions to their loved one, trying to get them to answer the question the way that they perceive that the answer should be said, or looking for the expectation that it should be told a certain way, right? That's the cheerleading, that's the coaching, that's the lecturing, that's sitting down with your loved one and telling them the 500 things they did wrong, and if they just went to college that they would be better off, right? Though, again, looking at how family risk factors are interfering with the recovery process. Entitlement. So when we see entitlement, it's across the board in the family, right? So they want special privileges, special treatment, special flip-flops, special bathing suits. They want to be treated differently. They want more sessions without any accountability, without following through with it. Giving additional resources and wanting to know why it's not working when you're not using any of those resources. So challenging the entitlement across the family system. The other challenge, which is on the other side of the spectrum, is the avoidance or the lack of involvement. Families want to say, I'm done. But at the same time, they're paying for treatment, or they're paying their rent, or they're paying their car. So what does really that look like? Lack of involvement being done. What is that message actually being created? What is the message you're actually saying and doing? So again, looking at the family's role with say what you mean what you say. You don't have to say it mean. That's from my early educational days, talking to children. The other philosophy around children is that I always told the adolescents, like when you point the finger, you're really pointing three fingers at yourself, right? And that really is fitting as well, as far as looking at your part again, reinforcing this time and time again, that it is ongoing, where if you're going to point the finger at someone, the expectation is that you're doing three things to work on yourself before you can tell someone else what they're doing wrong in the family. The other hard one, not only with the patients but with the families, is just adamant denial or refusal to do anything. Really, that is a huge treatment interfering value and belief that can come from significant generational themes of tough love, that can come from different dynamics within the family. Really, if they are done understanding what that language means, what is I'm done, or refusing to follow recommendations at that point, what does that do to the family system? More importantly, what does that do to the identified family member in recovery by saying, I'm not going to do it and you can come home? That is a huge adjustment for someone when they're working in their recovery and they actually stop that pattern, right? They identify to their family, I can't do this anymore because it's not best for my recovery. So some of the family shifts, right? When one family member shifts on the pendulum, the other family members have to make adjustments. Sometimes we see success where the family starts to heal and recover and the patient does. Unfortunately, sometimes we see the family members recover and not the patient. And then also credit to a lot of the identified patients, they make those changes for their recovery. And sometimes their family is not able to participate in their recovery because they chose not to do any of the work. And that's really the big part of the treatment, repeating it ongoing, right? The idea, the goal, the concept is not to pay for ongoing treatment. The boundary is really, this is your opportunity. We love you, we care for you, we want to provide for you, and this is our boundary. If a patient knows that they can go to treatment 13, 14, 15 times and the family will continue to pay for it, again, that is a family dynamic that needs to be shifted. Looking at how the family is sending a message of it's okay to relapse. It's okay to continue to do that way because we're here to pick you up. Again, it's creating that safety net that really is lost in communication because they're not asking to be saved. They're not asking for help. It's really about removing that safety net and allowing them to be independent, interdependent, and working on some of their own recovery growth, not only just for the identified patient, but also for the family participating. The family sometimes has to hit a bottom. Sometimes they have to scrape their knees. They have to learn that, wow, that actually hurts when my patient, my loved one is saying, I can't talk to you anymore. I have to go to a meeting. And those are some healthy boundaries that we encourage. So as I was addressing, right, so the family members have to stop problem solving for the patient. One that empowers the patient, it allows their loved one to mature and experience their own strengths and weaknesses, as well as the family understanding their own strengths and weaknesses. Really understanding that you may have some pain and there may be some anxiety, but that will be reduced over time in a safe environment. What happens is it breaks the codependent relationship when we're empowering each other to take care of themselves. It's okay to share that you're having a hard time or that this is hard for you. It is not okay to give an envelope of money to someone. Again, changing the course. It can be a similar theme, but interrupting what some of those patterns were in the past. The ultimate goal is to break some of that codependency and allow it to be an adult relationship. Boundaries. So treating the family. I know I keep going back to boundaries. That's a big one. Everybody likes to talk about them, but no one likes to do them because what that means is you're increasing expectations of yourself. The goal of the boundary for a family member is to be able to hold it, set it when they're in an emotionally healthy state of mind or when they're emotionally dysregulated. The goal of the boundary is to keep self-worth and self-respect. When you break your own boundaries and your own self-worth and your own self-respect, you have that emotional distress. And then that emotional distress comes out in different areas and can be projected onto a loved one to interfere with their recovery process. So some silly boundaries that I tell the patients here that I have that I don't share is I'm not going to tell you my home address. I'm not going to tell you how much money I have in my bank account. These boundaries don't have to be broadcasted to everybody, but they can be created with support through your support group, a therapist, an entrusted family member. But they have to be set for your own integrity. To be kept. So I'm not marching down the hallway. I'm not telling you where I'm going to live. But if anybody asks, my rule is that I'm not going to answer that question. How I say it and when I say it, that's something that I have to work on. And the families have to work on delivering different messages. Right? Again, focusing on yourself. Right? The greatest empowerment for the family system is asking the family to take care of themselves. Enjoy a cup of tea. Listen to your favorite song, spend an extra minute in the morning routine to say, I'm going to take care of myself. Really addressing the splitting and the secret keeping. It's really hard to find peace and serenity if you are holding a lie next to your husband or wife, partner, significant other, knowing that you just did something that goes against the values of the family. Again, impacting the larger family and how that interferes and how you interact ongoing and just communication, as well as if other people know you're lying and you're dishonest, it's really hard for them to invite you into the trust world. So the equilibrium, what I was referring to before, so when one family member changes, the rest of the family must adjust. Again, it may be weighted to one side, it may be balanced a little further. What we understand is when we meet recovery with recovery, the probability of success is larger. So when we're inviting families to go to support groups, we're inviting families to work on their own recovery, go see therapists, work on themselves. When their loved one is complaining or saying life is tough, no one said life would be easy, life is challenging, you meet it with recovery. Right? Which is, well, I went to a support group and I didn't have a good day. I went and saw my therapist. I talked to my sponsor. I did my own 12-step work. What that does is it promotes and models the recovery belief system, the recovery values. More importantly is if they want to join in the dynamic, they need to participate in recovery. Again, modeling and asking and encouraging without enabling and saying, I can only stay in recovery if my loved one is in recovery. That is not what we're asking them to do. All right, so this is a situation of what I would define as a family system that needs to be looked at. What we're trying to do in this situation, and I'll read it shortly, is identify who is the patient, who needs care, who really in the family needs to do the most work. So when we're dealing with family systems, right, again, the identified patient comes to us because the family says this is the patient and this is who we're coming here to work with. But in fact, we find out that everybody in the home has different issues, right? It's usually easiest to see when there's a crisis. It doesn't mean that one's beliefs, mental status, physical status is higher or lower in the hierarchy of change. So really addressing who in the family may need some support and who needs some help. But when it comes to find out that most people need some form of support and help, they're just too afraid to ask for it in whatever belief, family of origin, or creation was, that we don't ask for help, we're determined. We're the Perlmans, we put our heads down, we fix things, right? And what we come to believe is that we can problem solve, right? As long as the door's closed, we'll be able to figure it out. But realizing that everybody else knows that something's wrong. And just the people inside the house when the door is closed believe that everything is better because we're all in the house. So this is one example of Sandy and Rob. So they're married with children. Rob's father died when he was 15, and Rob deals with stress through work. He gets angry at times when he's too emotional. Again, is that something that he needs to work on? Sandy's parents divorced when she was 12. She's the oldest and she helps her two young siblings through custody issues. So is she the identified parent? We don't know yet. Again, exploring all areas. There's a daughter who's using drugs, who is the identified patient, right? So she's not moving forward in school. She's needy, she's anxious, she's struggling on what she should do. They also have an 18-year-old son finishing high school with no plans after that. So they want to do an intervention. And the question that I pose, and I know it's all muted and everybody's off, is like, is who would the intervention be put on at this point, right? Is this a family intervention, or is this an identified patient crisis harm, right? Is anybody in imminent danger? Is anybody reporting self-injurious behavior? Do we intervene on the family, or do we intervene on the identified drugs that the daughter is using? So this is how we would go about it, right? Looking at it from a family model and looking at it from a psychodynamic approach. So we want to have everybody participate, internal and external resources to manage their own anxiety, right? So more importantly, we got to get everybody to be able to be at emotionally regulated state to be able to participate in a conversation on what the intervention looks like and how we can help. And really, again, families are perceived that they're responsible, they're going to fix the internal conflict, the dependency and codependent positions start to deteriorate when we are able to address and talk about and have a conversation about what's going on, right? Mom's not going to do your laundry anymore. You're not going to be able to live in the house anymore if you're under the influence. We want to support and promote education, or we're not willing to pay for it if you're not going to do anything with it. So that's really the start of intervening with boundaries. Of course, we can do the traditional sitting down and interfering with what are the dynamics, giving our opinions and values, telling the family what they should do, and remove someone from the home, right? That can be a modality. But when we're looking at it from a family systems approach, is that if we, again, I'm repeating myself, I apologize. If we remove the identified patient, what happens to the family? So is the example before, is there more yelling? Is he too emotional now? Is there aggression in the house? Is the younger one who doesn't have any substance issues start to use substances? So when we do an intervention, we want the whole family involved. And I'm proud to say that most interventionists and most clinicians in the industry really are looking at the focus of the whole family. Really, it's not a remove and identify and fix. So with that, really looking at how the family can participate long-term and how they can stop the dependency, how they can break the codependency. So the family members assume sober adult relationships, sober social networks and activities, work, school tasks, adult-to-adult relationships, and parenting, right? So again, it's about readjusting. An adult-adult relationship doesn't mean you stop being a parent. What that means is your parenting roles have shifted, right? So there's some growth in parenting where, again, showing up, bringing dinner to your loved one's house, or showing up and saying, oh, you must need this paper towel because I ran out of paper towel. That's not really an adult-adult relationship. Again, it's earning before receiving. It's about defining the difference between enabling and helping, right? So enabling is doing something for someone because you perceive or think that they need help with it. Helping is allowing someone to come to you and asking for help. And then the greatest gift that a family can give is say, I'm going to think about it and I'll get back to you if I can help. What that does is creates a pause. It breaks the dependency, it breaks the codependency, as well as it gives the family member an opportunity while they're bike riding, working, and holding the dog on a leash at the same time to not have to answer in the moment because it's not a crisis, and that they can enjoy the dog walk and they can enjoy the bike ride. And again, that's part of the principles of recovery for the family. Again, reiterating, breaking the codependency, breaking that position, and becoming more internally dependent on your own values and belief systems, and not relying on other people's opinions to drive or guide your recovery process. So I put Q&A if anybody has any questions or answers. I I also wanted to give an opportunity to thank everybody and apologize again for Phoenix stepping away and letting me take the driver's seat. It's an honor and a privilege, and thank you everybody for that opportunity.
Absolutely. Thank you so much, Michael, for this presentation. I think I speak for all of us who've attended today that your time and experience at Caron has definitely, it's a credit to the knowledge and all the support that you've been able to provide to us today and learning how to support the individual and family a bit more through this process. So thank you. We do have some questions. I'm curious at the kind of the beginning point of your presentation, you spoke a bit about fear of loss in early recovery for families. Can you expand just a little bit more on that, specifically advice and additional tools that you might give to professionals who are in that place supporting that conversation with their clients and families?
Yeah, so there is a true fear of a loss or a role changing. Absolutely. So part of that tool or recovery process for the family as well as the loved one is there is a mourning process of the addict or active addiction to be a loss in the family, right? So there is a desire to want to hold on to that. So really the tool that I use is really talking about the mourning process that the patient goes through with substance and abstinence from that substance, but also addressing that there is true loss in an identity, and that the behavioral shift is to mourn that that person in active addiction is no longer.
Yeah, absolutely. Thank you for that. I'm curious if a family is not willing to work toward change, right? And they think it might not be their problem. How do you get everyone on the same page in terms of working toward a goal?
Yeah, so there's a lot of one understanding in language, right? So using important words and understanding their philosophy and what it looks like when they are refusing or unwilling or fill in the blank, right? So part of it meeting them where they're at, but also being able to address what they can tolerate and what they can do. And also being able to be direct and honest with the family member that they are impacting other family members in their recovery process. So
Yeah, absolutely. How do you support a patient, the identified patient in treatment when a family member has an active addiction that they're not treating?
So very, very similar to the work that we would do internally, we would attempt to do externally with the family, right? And again, is addressing that this is interfering with their loved one's recovery process, and really addressing that this is going to make a ripple effect in the family system. Some of the conversation, even with the family member on the phone with the patient, is acknowledging that this person may not be able to be around you unless you choose to join recovery. So really having a direct conversation specifically with the active user outside the program to acknowledge that they may not have a relationship if they continue to use.
Absolutely. What do you do if the identified patient refuses to participate in therapy or any intervention?
It's a great question, right? So as far as like the family, right, looking at from their lens is what first understanding before you go into the boundary setting is understanding what their limitations are. So if a patient is unwilling to participate and is unwilling to engage, what are the family's limitations, right? Don't threaten I'm not going to pay for treatment anymore, because what that really means is that they are going to be leaving, right? So the other conversation to have with the family as well as the patient is understanding why they're here, how they got here, addressing some of the timeline and history of events that led them to come to treatment, and addressing that that there's some behavioral concerns that led them here, and if they're not significant, look at them, address them, and then move on.
And I think we have time for one more question. Can you repeat the brief defined difference you stated a few minutes ago, helping versus enabling?
Sure. The difference between enabling and helping. So enabling is doing something for a loved one when they're capable of doing it for themselves and they're not asking for help. That's enabling. It's providing something, giving to them when you perceive that they're struggling and you're prematurely interjecting. Helping is allowing your loved one to develop some skills, to ask for help, develop the ability to structure what their needs are, and then more importantly, ask for them. Before helping or giving the help, allowing them, giving them that adult-adult relationship, allowing them to ask for it, and then ultimately the family or whoever they're asking for help for gets to decide, in fact, if they want to help, rather than the enabling is doing it for them, perceiving or believing that they in fact need help.
Absolutely. Well, I think that's all the time we have for today. So thank you once again, Michael, so much for joining us,
Yeah.
for presenting, and for all of our attendees for joining us today. Thank you so much for your time. As a reminder, please keep your Zoom window open to access the eval that will pop through for the social work credits. And we're, of course, looking forward to hosting our second webinar next month. You can watch in your email for additional details. In the meantime, feel free to sign up for any webinars that are hosted by our care and treatment centers. They will be, they might be listed here on the screen. If not, you can access a full list of our upcoming webinars at any time by visiting our website at www.caron.org/webinars. Feel free to contact myself or your designated regional resource director at any time. A full list of our team with their contact information is also listed here on the screen. We are happy to answer any questions that you might have about Caron's programs, services, continued questions you might have regarding our family programming, anything that you might need, collaborating with your practice or organization, looking for additional resources in your area, support with admitting an individual to Caron, don't hesitate to reach out. We are happy to be a resource for you. Thank you all so much for joining, and we wish you a great afternoon and a healthy start to 2021.